What happens if you don't cut the umbilical cord at all?
This is not the same as delayed cord clamping.
As we finalize our Neonatal Cocoa Pods podcast, in which we have been talking to Dr. Ekwase Sanusi for the past several episodes, we take questions, and one of the questions that we want to finish this round with is that what happens if you don't cut the umbilical cord at all? Well, let's use this as an opportunity to talk about Lotus Birth. Lotus, Lotus, birth. Lotus birth is also called umbilical non-severance. That is, we do not cut the umbilical cord. This practice was named after Claire Lotus, who observed that chimpanzees did not separate the placenta from the newborn. A lotus birth is the decision to leave your baby's umbilical cord attached after they are born. The umbilical cord remains attached to the placenta until it dries and falls off by itself. So, by way of introduction, lotus birth is the practice of birthing the baby and placenta and leaving the two attached until the cord falls off on its own. And this can take anywhere from 3 to 10 days. The lack of intervention in lotus birth has attracted people in the natural birth world. It is believed by them to be gentle and beneficial to the baby. There is hardly any research on lotus birth or its risks and benefits. Since there is no solid research on lotus birth, it is not clear if the practice is actually beneficial. It could be that delayed cord clamping provides all of the post-birth benefits from the placenta and that nothing beyond that is necessary. The people that love lotus birth, the practitioners of lotus birth, claim that the benefits include a gentle, less invasive transition for the baby from the womb to the world because it does not cause any injury to the cord. Increased blood and nourishment from the placenta, decreased injury to the belly button, and a spiritual ritual to honor the shared life between baby and placenta. There is no research to support the first three claims. The placenta receives its blood supply from the mother, and once the placenta is birthed, it's no longer living or circulating blood because after birth, the placenta is a dead organ with stagnant blood. So it's unlikely that keeping the baby and the placenta attached can really provide any benefits. There's not enough research to say how much higher the risk of infection may be with a lotus birth. Lotus birth can also be a spiritual practice to honor the relationship between the infant and its placenta. If you want to honor the placenta, but unsure if lotus birth is right for you, there are other rituals you can use, like burying it in a special ceremony. Most healthcare providers will not perform a lotus birth delivery because of the lack of research. The major mom and fetal health organizations don't have statements on lotus birth because it's rare. So what are the risks of lotus birth? There's limited research, but we know that once out of the womb, the blood stops flowing to the placenta. At this point, the placenta becomes dead tissue that is prone to infection. And because the placenta is still attached to the baby, an infected placenta can infect the infant. Additionally, the baby risks injury of the cord accidentally being ripped away from their body. This is known as cord avulsion. And there has been case studies out there. One case study of a full-term baby linked Lotus birth with hepatitis in the baby, though more research is needed. And there are special considerations for a Lotus birth because the baby and the placenta are still attached by the umbilical cord. The mom's postpartum experience and the newborn care will be different, like from after a conventional birth. The mom is going to need a sterile place to catch and carry the placenta around. The mom must still put the baby in a car seat to drive with the placenta attached. The placenta will slowly dry out and decay, and eventually the cord will fall off from the baby's tummy. The placenta will probably have a smell as the blood sits in it stagnant. And some people report rubbing salts and herbs on the placenta as it dries out. And keeping the placenta attached is in no way a replacement for feeding the baby because the placenta is no longer attached to the mom. It does not provide nutrients to the baby. Newborns feed at least every 2 to 3 hours. And then baby clothing will need to have an opening in the middle where the cord is coming out from. So while you want to keep your baby clean, we don't know if it's safe or not to give your baby a bath with Lotus Birth. Most doctors and hospital midwives have standards and practices based on research and conventional training and will not support a Lotus Birth delivery. So are there any risks with this practice of Lotus Birth? There are not a lot of research studies available on this topic, but know that once the umbilical cord and placenta are out of the womb, blood will stop circulating and the placenta will be dead tissue. The blood in the placenta could get an infection and infect the baby. And signs of an infection for the baby would be redness, warmth, swelling around the umbilical area, temperature greater than 100.4. The baby is feeding poorly. The baby is peeing less or having less stools. The baby is sleeping more than usual. And the mom has to wake the baby up to feed more than is normal. A newborn baby that is infected may do very poorly with an infection or could die. So the umbilical cord is attached to the placenta, which is birthed soon after the baby. Babies can be left attached to the placenta for a few minutes after both are birthed, but you don't want to leave them attached for days while the placenta dries out and rots. You should realize that the umbilical cord is the organ used to transfer nutrients from the mom's body to the baby. At the same time, the cord is used as a sanitation pipe because the baby's waste products need to be removed somehow. So this umbilical cord is not sterile when it's outside of the mom, to put it mildly. Therefore, it needs to be removed to avoid infection. And what is the deal with letting the cord pulsate? So we had another question from one of our listeners. What is the deal with letting the cord pulsate after birth? The cord will pulsate after birth, pumping blood and oxygen into the baby. This is good for the baby. Babies are birthed with some blood in the cord to make birth easier. Some people think cord clamping should occur only after the cord finishes pulsating, ensuring that baby gets all that blood. Another question we had is that what will happen if you don't clamp the cord and you cut it? Well, the baby will bleed out. Thank you for listening to our Neonatal Cocoa Pods series. Please continue to post your questions to birthcenterfoundation.com. That is BIRTHCENTER foundation.com.